I think at this point it's prudent that I mention I am a resident of Nakuru County, so definitely looking forward to that inauguration of the city status this morning, and definitely wake up you abreast with the information and the pictures and sounds coming from that county. But let's switch gears back in studio and focus on what I had mentioned earlier on, that the use of chemical, biological, radiological and nuclear, abbreviated as CBRN technology, is rampant across the globe. However, in it, just like any other thing, there's some people who can misuse it, and there are risks that can come out of the same. So how do we ensure we mitigate the same? Well, I have with me in studio a panel that will help us figure out this and much, much more. We have Professor Erastus Gatebe, who is the chairman of Kenyan Nuclear Regulatory Authority, also joined by Joseph Minor, who is the Director General at the Kenyan Nuclear Regulatory Authority, and joining us virtually is Harold Wittemans, who is the Regional Coordinator for Eastern and Central Africa at the United Nations Inter-Regional Crime and Justice Research Institute, which is abbreviated as UNICRI. Thank you for your time. Now, gentlemen, definitely a conversation that most Kenyans perhaps are hearing for the first time. So let's educate each other this morning, and starting off with the fact that the Kenya Nuclear Regulatory Authority was established in January of 2020. What necessitated this, and what is the mandate of KNRA, Erastus?
Thank you. Good morning, and good morning, Kenyans. I want to say thank you for inviting us to educate Kenyans on the issues around the Kenya Nuclear Regulatory Authority, or nuclear technology per se. Kenya Nuclear Regulatory Authority is the predecessor of the former Kenya Radiation Protection Board, which was developed, or which was promulgated in 1982 and came into operation in 1986. So the Kenya Nuclear Regulatory Authority is basically an institution which, due to the challenges and the emerging issues, that made it possible for us to amend the law and encompass the changing needs of the country. So the Kenya Nuclear Regulatory Authority, which came into use, as you have correctly mentioned, in January of last year, that is 10th of January 2020, is basically repealing or repealed the former Radiation Protection Board Act, Cap 243. And it is the one that has anchored us in the law so that we can deal with the issues at hand.
And when you say dealing with the issues at hand, what exactly is this mandate?
The mandate of Kenya Nuclear Regulatory Authority is basically to safeguard Kenyans on matters to do with the nuclear. One of them is the nuclear safety. I heard you in the news, you saying that the president is going to inaugurate a radiotherapy facility in Nakuru County. We are the regulator of that. We are the one who gives the license to operate, as well as even the workers. So Kenya Nuclear Regulatory Authority is responsible for both the workers and the facilities in the country. The other mandate, which is anchored in the law, is the nuclear security. As you are aware, any material, if not used properly, can be turned around and be used by, let me use the word, bad guys. So the Kenya Nuclear Regulatory Authority is the one responsible and charged with ensuring that those materials are properly utilized, including the sources that are used in radiotherapies. We call them hot sources sometimes. They have different categories. The other issue we deal with is the safety, the security, safety, and safeguard. The safeguard is to me that aspect of keeping the materials in a more secure, in a more, even the way you handle the materials. So that is another thing. But more so at the moment, as a country, I think the issues to do with safety is of paramount, because as we expand our radiotherapy, cancer treatments, all those materials. Remember, a few weeks ago, His Excellency the President launched the Integrated Molecular Imaging Center at KUTRH, and that facility is also supposed to produce some medicine to treat cancers, they need transportations. So it is the regulator who is supposed to make sure that the transport, the processes, and even the exposures are within the limit. So we keep and we monitor those kind of, yes.
Okay, so Joseph, let's first understand the uses. We said they can be of good use, but also they can be misused. So what are the uses of chemical, biological, radiological, and nuclear technology in Kenya?
So thank you, Gladys, and it's a pleasure to be here to explain the uses of nuclear technology and uses of radiation technology as well. The major uses of nuclear technology in Kenya is actually in medicine. We do have cancer treatment or cancer management. We do have diagnostic radiology and interventional radiology in medicine. We do have nuclear medicine itself, nuclear medicine departments in most of the major hospitals in the country. So this is an area where nuclear technology is actually applied, and at present it is irreplaceable. Number two, nuclear technology is used in agriculture. One, for food security in terms of eradicating the sese. Two, in terms of plant breeding, in order to produce crop varieties that are drought resistant, that are disease resistant, and it is widely used in most of our institutions, both research as well as development institutions. We also use it in animal production. For example, we have a facility under the Ministry of Agriculture where this technology is in use for increasing milk production. The other application is in industry. Industrial applications are quite widespread in terms of the manufacturing, where we use this technology for industrial process control. And most of the industries in Kenya are actually using this technology. We also use it in road construction, and we also use it in air pollution studies. So it is quite widespread in most of the sectors within the economy.
Okay, now I'm curious to know, when you talk about road construction, how does it apply?
Road construction is, there is a technique that is used where radioactive materials are used to look at the compaction of the roads. Moisture density, material density, water content, tarmac thickness. So it is widely used in the road construction. Any road you see being constructed, there is a nuclear gauge that gives the quality assurance and quality control for the road. So
that's how it applies.
That's how it applies.
When it comes to the animals, exactly how do we apply this?
When we come to animals like the famous International Livestock Research Institute, they have to use tracer radioactive materials to look at the efficacy of what we call aggravate medicines, both new and probably those under application, and to look at disease control in animals. So they use radio tracers, and these are also widely used, and also in laboratory research. Number two, they use irradiation to irradiate, for example, mice or maybe primates or any other animal they feel would yield research results that would be beneficial to both animal and human health.
And of course, to what anchors a big part of our economy, agriculture. How do we apply this?
Agriculture, for example, when we look at plant breeding, plant mutation, what happens is that when we are looking for a variety of crop which would be drought resistant to be applicable to a particular region which is drought prone, or a plant resistant to a certain fungus or a certain disease, then the seeds are irradiated using nuclear technology to mutate to a particular breed. Of course, there are so many, but a particular breed would result in better yield and better resistance to disease, as well as to better withstand drought.
Okay, so
and Kenya has been fitted by the International Atomic Energy Agency for actually producing a wheat variety, which is resistant to the UG99 rust and has better yields.
Okay.
This wheat variety has already been given to farmers for production. It is in production.
And now that you're talking about drought resistance, we're in the middle of a drought season in parts of this country, and of course global warming is part and parcel of us. Does this mean that now you're working overtime to ensure that we give solutions going forward in terms of agriculture?
Yeah, in terms of agriculture, there is really a lot going on. Yeah, to try and map crop varieties with drought-prone areas, and probably same with the research on water.
Okay, let's introduce the other gentleman in this conversation. Harrow, you represent UNICRI in the eastern and central region of the continent. What exactly is your mandate?
Good morning, Gladys. Thank you for having me on. So, as a regional coordinator, I have to coordinate the activities of the EU CBRN Centers of Excellence initiative. It's an initiative funded by the EU, which brings together partner countries to share knowledge, to promote the development of policies on CBRN materials and the risks related to them. And basically my role then is to facilitate those meetings, facilitate the workshops that feed into developing the policy, to connect to potential partners in implementing priorities and implementing capacity gaps that are identified. So basically, I'm the spider in the web that tries to bring all the parties together in this effort to reduce the risks of CBRN materials.
Now, Joseph has tabulated how Kenya uses CBRN. Is this the same? Does it replicate to the central region of this continent?
Well, the applications of the CBRN materials, of course, they are the same everywhere. How much a country uses them, of course, depends on the economy, on the development of technology, on the priorities. But in principle, yes, all these technologies and good uses of CBRN materials are available and used everywhere, all over the world, not just in the East and Central Africa region. But at the same time, this also means that the risks related to handling it, storing it, waste matters, is also present in all these countries.
All right. And you are based in Kenya. Why Kenya?
When the initiative started in 2010, a couple of pioneering countries joined the initiative. Amongst the first ones in the region were Kenya, Uganda, Rwanda. All over the world, we had regional secretariats establishing, but they were virtual entities. Then Kenya proposed to actually host the actual physical office, which is what we're going to actually be inaugurating tomorrow. And since I'm coordinating for this region, I will be based in that office here in Nairobi.
Okay, now before we get to the inauguration that will be happening tomorrow, I think we need to understand, as you had mentioned, Erastus, that in October of this year, President Uhuru Kenyatta officially opened the Integrated Molecular Imaging and Hospitality Center at the KUTRH, and this essentially expands the country's cancer diagnostic capacity. Does this, you said this falls under your purview?
Yes, in terms of regulatory perspective, we are the regulator of any nuclear technology in the country.
Okay.
Basically, if you go to any hospital, you get a radiotherapy equipment,
yes,
you'll always find our license there. If you get an X-ray worker or radiographer, even those medical doctors practicing, radiology, somehow they have to get our license because we need to give them the authority to know what they are doing is within the purview of the law.
Okay.
So, yeah, we work very closely as part of our UHEC support under the Ministry of Health. What we basically do is we work with the facilities. For example, if it is the IMIC Center, we seconded officers to work with KUTLH staff and technical people. I think the GE Electric, who are their main contractors, so that they can work together in case there is licensing needed, there is anything that is needed from a regulatory perspective. From importation, we work closely with any government agency or hospital which is going through that line. The same way with any, if you go to Mombasa, recently we visited the CAT lab in the former Provincial General Hospital. When you find those facilities, you can be sure Kenya Nuclear Regulatory Authority is part of that in terms of ensuring quality and, of course, the safety of Kenyans.
All right. Speaking about the safety of Kenyans, this definitely is a plus when it comes to diagnostics in Kenya, but it also calls on a lot of exposure to these Kenyans we are talking about who are seeking these services. So how does the framework ensure that the Kenyan who is seeking this service is protected?
Thank you, Gladys. I think, yeah, you know, we have the law. The Kenya Nuclear Regulatory Act is very clear in terms of its mandate, in terms of maintaining the, the safety or the standards. Currently, because the law is still new, as you correctly mentioned, we are actually doing the implementing regulations. We have developed about 8 set of implementing regulations. They are now under wider view of stakeholder participations because you have to subject them to the stakeholders. But the aim is to make sure that the exposure levels, but we still have an operation law. So the dose levels, the exposure levels are within the purview, because safety is very important in health. And when you look at the exposures, as you have correctly said, you need to know how much dosage are you being given. We do monitor, and Joseph can explain actually more how we go about the process.
Joseph?
Yeah, thank you, Prof. What happens is, one, I would like to mention early on that the primary responsibility for any facility, be it medical, be it industrial, be it road construction, the primary responsibility for safety rests with the licensee. That is a concept that is actually inculcated at the very beginning, at the concept stage of a facility, that the licensee will be a primary responsibility. The Kenya Nuclear Regulatory Authority is to ensure that the requirements for safety are actually complied with, the standards are met, and oversight is provided by the authority. And we have put in, the necessary requirements and measures and necessary regimes within facilities to ensure that the facility comply.
And if I am a recipient, a customer who's going in and saying, I need this service, are there specifics that I should look out for? Perhaps, they say go into a doctor's office and look at what is hung on his notice board just to ensure that they are actually licensed. And if in case I have any concerns, where can I actually report this?
Those concerns, for example, the basic minimum for safety for the customer or for the patient in this case is one, there should be a chart hanging somewhere within the room, and of course the professional healthcare provider or service provider is obligated to inform the client that, for example, should a lady be expectant, they should inform the service care provider so that the fetus is actually protected. And they should get more or less some informed consent from the client.
Okay, arrest us in case of negligence. Where do the patients go to?
You see, Gladys, that's a good question, but medical field is a regulated field. Yeah. As I said at the beginning, we as Kenya Nuclear Regulatory Authority, our main purpose is is to make sure that you secure, it's the safety, it's the operation, both the work and the facility. When it comes now to the medical negligence, I think the rest of the medical teams, for example, if it's a medical doctor, the Kenya Medical and Dentist Board, and these days they are councils. The councils take care of that. What we do take care of is the facility. The facility, the qualification of the workers, as well as does the facility meet the minimum requirement. For example, you have an X-ray machine. There are certain requirements in terms of the how you construct that facility. But in terms of the medical negligence, that one now goes to the regulators of the workers. Yeah, but for us, the much we can do is to cross the facility. Yeah, that is now what we can do. We find it has some integrity issues. The training of the staff have not met their minimum requirement. That's where we come in on the facility. But let me say this. The Kenya Nuclear Regulatory Authority works we work seamlessly under the Ministry of Health. We have inspection teams and one of the regulators and the ministry. So when they go out there, although we do our own, they also go and try to see, holistically, whether the facility meets all the requirement. But on our case, day-to-day work, we do inspect facilities, we do inspect the integrity as well as the workers themselves to see whether they are complying. And every month, for example, if you work in a radiotherapy unit, we normally receive the dose levels of those workers, how much they have been exposed, so that if they are overexposed, then we always, as a regulator, we give guidance on the same.
Okay, now Haro, you have worked in the Eastern Central Africa, but before this you were in the Asian continent. When it comes to regulation, especially in the medical perspective, how hard is this and what have you seen done to ensure that the patient is protected?
I can speak about the general state, because I will not, of course, be involved in the micro level of how a country manages and implements their regulation. But in principle, the main point is to start having an agreement on what is to be regulated, how to do it, and who will do it. So in Kenya, they've advanced very far in this, with the KNRA being on top of the matters. In most countries, there is some form of regulatory authority, especially on the nuclear and radioactive materials side. But the development is a long process, because you need to build up knowledge, you build up experience, and that is one of the things that is very strong about this network of countries that join in the CBRN Centers of Excellence. They exchange knowledge, so they train together, they share their challenges so that others don't have to go through the same thing. They share their best practices to speed up, let's say, the catching up of countries that may need to develop further to come to an internationally agreed level.
And our conversation today is mitigating the risks that come with the use of CBRN. Joseph, which are these hazards that are of concern, apart from now the medical bit that we have touched on?
Thank you, Gladys. Some of the hazards or some of the risks that are to be mitigated. One is these materials, the CBRN materials, have become attractive targets by non-state actors, by extremists, by terrorists, for non-peaceful uses. And we have to evaluate the risks as per each material and each category, and the consequential hazard, the magnitude of the consequential hazard, and then put in risk mitigation. One is theft of the material. Two, illegal transfer of the material. Three, illicit trafficking. Our region is quite, for example, our region is quite rich in terms of uranium, the Eastern and Central Africa. And you'll always find cases either in the press or sometimes it doesn't come to the press within the security and law enforcement agencies that this material is under illicit trafficking, cross-border. Of course, when it is not under regulatory control, it is not intended for peaceful uses. So these are the risks: unauthorized access, theft, sabotage, and illicit trafficking. These are the risks we usually mitigate against.
Okay, so to break it down to a common one, Ainchi, what exactly does that look like? What is normally, for example, stolen?
What would be stolen is, for example, a cobalt 60 in a radiotherapy department. A very beneficial, useful, peaceful application of nuclear technology for cancer treatment. But this particular material, which is actually radioactive and the risk category is quite high, can become a target either for sabotage, either for theft, or for unauthorized transfer. So we have to put in risk mitigation measures against that while we are still using it. Or when it is retired, we still have to follow it up to a secure, safe, and of course, well-managed storage. Yeah.
Okay, so we're talking about illicit trafficking. Erastus, how or what is feeding into this?
Come up again.
What is feeding illicit trafficking of radiological and nuclear materials within the region?
We have had a few incidences where we normally have, of course, we work very closely with our security systems. Actually, they have been part of the Kenyan Nuclear Regulatory Authority. If you remember, the Miscellaneous Law Amendment Act 2014 brought in the National Police, the National Intelligence, and the National Defense into the board. So we are like one, you know, whenever an issue arises, it is always looked at from that angle. But because as what Joseph has said, that this area is rich with a lot of materials, basically the kind of illicit we have, we still actually, like now we have 2 active cases in the court, is we normally find those, you know, peaceful use materials, the gauges, now being trafficked where we don't know. But those are not very much, and that's why this initiative of especially the CBLN is coming in, so that when something leaves Congo or DRC or Uganda or any other place, Ethiopia, we are able to know what is the purpose. As Joseph has correctly put it, if it is not under the purview of regulatory, it's become now trafficking. And that is the issue at hand now.
Okay, yes. And is the cost perhaps something that fuels this, the cost of these materials that can be used beneficially, especially in the medical field?
Yeah, the cost is also a factor, because you see, you look at that facility itself, it's quite expensive, it's a capital intensive. So when something can, you know, and the most important thing is the amount of money that it can be involved, but in terms of purchasing the equipment, but more so, nuclear field, for example, is highly regulated from the manufacturer to the user. We maintain the database of whatever is in the country. So it's, yeah, the cost is a factor, but more so the trafficking part, which is the non-state actors, is what keeps our eyes open.
Okay. Now, Harry, before I take a quick break here on Your World, tell us this, in terms of the risk or hazards that Joseph and Erastus have elaborated in the region, what have you seen, and how are the state actors ensuring that this is kept at a low?
Well, as you have heard, the applications are very diverse, and that means also the people that will be handling it are going to be very diverse. So from highly educated, highly trained professionals to maybe less trained and less educated professionals, or even people who accidentally are asked to handle these materials. So that is a very important point, that there's an oversight both on the labor side, the safety of the persons, on the security side. The countries in the region have a very strong drive to actually manage these materials. So they are pushing very much for enhancement. And at the moment, we are wrapping up a 4-year project on nuclear security in the region, which covers all 11 partner countries, which has brought them all together. So we are seeing a very strong increase in the capacity and the potency of dealing with these risks.
And what is the burden especially and the risk factor attached to the terrorism factor?
Well, luckily there are very, very few people who actually want to hurt others, or at least want to and do it. So the risk is there, but luckily it's not as huge as we could have feared. Because even getting access to these materials is very difficult, but also using it feels unnatural in a way to do it. You see that if there is a grievance, usually it's used with, let's say, the clubs and guns. Using these materials, it's really a step further, and it really also risks becoming, as a terrorist organization, an outcast, because it's not acceptable to use these kind of materials that are also indiscriminate. So there is that risk, but we also see that there's a very strong control system to prevent it, and a moral system, which is also, I think, a very reasonable element that we also have to remember.
Now, at this point, we take a short break here on Your World. When we return, you heard Harem mention that tomorrow we shall be witnessing the establishment of the Regional Secretariat representing East and Central Africa, whose headquarters will be actually right here in Kenya. So what is the mandate of this Secretariat, and what does that mean for the region going forward? We find out in a moment. Stay with us.